rich here in many ways on the Suncoast, but we are greatly lacking in one area. The U.S. Department of Health and Human Services has diagnosed Sarasota and Manatee counties with health professional shortage. They say current mental health systems lack the capacity to meet our rapidly expanding demand for services.
Samaritan Counseling Services is working to meet those increasing needs. And joining us now, Executive Director Rick Howell and Community Care Director John Gregory. Welcome, guys. We're so happy to have you here today. So tell us about Samaritan Counseling Services.
Well, it's great for us to be here and to share our story for the community. As Samaritan gets ready to celebrate our 25th anniversary, we are aware on a daily basis that the need is bigger than what we can provide. Samaritan is an outpatient mental health counseling team, and we have 12 locations across the area, and we do mental health counseling with an emphasis on spiritual integration, and see people who have insurance and people who are uninsured. Large group, we have about 100 new clients every month.
Wow. So the need is increasing here on the Suncoast.
Absolutely.
And you just got help to meet those needs with a major grant, I understand.
Yes, we did, and that grant is to help us with our intern program. We have another component to our work is an intern program we started in 2015, and currently we have 7 interns, and that it helps us in so many ways. We don't have enough time to talk about how our intern program helps us and helps the community, but that grant is to help us continue to beef that up and provide the budget that we need to have those interns coming in, and it also helping us continue to expand our services in the community as well.
So that's part of the solution, it sounds like.
Correct.
Absolutely. 30% of our sessions are provided by our interns, and those sessions are able to be we charge less because interns aren't licensed, and we are able to collect less because interns aren't compensated at the master's level licensed folks. It has helped us. About 30% of our sessions are provided by them, and one of the great things that they've helped us do is create partnerships with other local nonprofits who have great work. They're doing great work, but they have a mental health component, and we are able to provide those mental health services to those folks who are being cared for in other nonprofits at a much more efficient and effective way than when we didn't have the interns.
And even with those interns, it sounds like these interns are still trained. They just are ready to get their license issued, but they're not newbies.
That's correct, and that's an important thing for us to make clear. They've finished all of their education, and they've become registered interns with the state of Florida, and then to become fully licensed, they have to do 1,500 counseling hours over the course of 2 years and receive 150 hours of supervision in that process. So it is very much a refining of what they learned in their education into the practice of the mental health counseling real life.
Real life is the key.
So we're helping them help us.
Right. It's a really great partnership. They need the experience. Samaritan has 31 counselors, and so 24 of those are fully licensed, and they become mentors for these interns. And some of our licensed counselors have been practicing for 30 years. And so you have the benefit of folks who've been around the block helping the interns, but you also have the interns helping those folks who've been around for a long time because they have the most recent training about best practices in terms of intervention for different mental health diagnoses.
So if I'm listening out there and I feel like I'm having some mental health issues, I call Samaritan, and then how does it work?
So when they call, they speak with our intake coordinator, and the intake coordinator is going to take all their information, but also one of the key questions is what's your need right now, and where do you live, all those insurance questions to help them connect them to the best counselor that's available at that time. And if they need some assistance financially with that, we also are there to meet that need. We're not going to turn anyone away for cost purposes. And of course, that intern option is there to help us with that as well. So that's the first step. It's just making that phone call, which is big.
Right, it's hard to do.
If you're in a crisis or you're trying to deal with the abuse, not the abuse, the stigma of mental health, that phone call is a big deal. And we recognize that.
Oh, yes. You have a speaker series coming up.
Yes, John's been a part of that.
Yeah, another way we're expanding services to the community is to provide community events. We just did a summit in June, a Faith and Mental Wellness Summit. So our next event is a speaker series that we're calling Give Them Hope. It's a 3-part speaker series, and the first one is October 26th. It will be held at Robert Tolan & Sons Celebration of Life Center in Lakewood Ranch. And the topic that day is 988 and You, working together to create a safer suicide community. So Kimberly Kernan with the Tampa Bay Crisis 211, she's the director for their 988 program. She's going to be our speaker that day. So this is just one way to help the community know we're here for you individually, but we also want to educate and make you aware of services and how to respond in different situations.
So you can listen and learn before you take that step, too.
Correct.
And you'll know what is available.
That's right.
Oh, that's so good. Thank you guys so much. Congratulations on the grant. And that Give Them Hope speaker series kicks off on October 26th at Robert Tolan & Sons in Bradenton. For more information, go to SamaritanGulfCoast.com.